Michael Gallagher, physical therapist. On our last video, we talked a little bit about treating acute back pain. Spoke about use of modalities such as electrical stimulation, hot and cold. Talked a little bit about flexion exercises, stretching of the low back. In this video, we're going to talk about strengthening and also realigning the spine. Rob McKenzie is a physical therapist from Australia who I was fortunate enough to actually see lecture some 30 years ago at a conference in Australia. Dr. McKenzie believed everything had to be done into an extension motion. Even at that time, as a young physical therapist, I said, I'm not going to argue with the man, but there has to be more to it. In saying that, I still utilize and use McKenzie techniques on a daily basis in my facility. So in our last video, we had Shannon laying on her back or in a supine position. Today we're going to have her lay or on her stomach in a prone position. So you're going to bring your head down here, Shannon. And again, the McKenzie or extension theory of treating back discomfort is based on the spine being in an extended position, opening up those vertebral foramina so the nerves can pass through freely. So Shannon's already, without me asking, has gotten into the perfect position, prone on elbows. This is a great way if you're reading a book or watching TV. Just this position alone will cause an extension motion at the back, thus decreasing pain. Many patients will take a pillow or a bolster and kind of place it underneath their arms and chest and just lean on it. It's a little bit more comfortable sometimes than actually leaning on your elbows. But just maintaining this position between 5 and 10 minutes puts the back in a position where the musculature or the paraspinal musculature is at rest and the spine is in an advantageous position to take the pressure off the nerves. So this is a passive exercise which again will help relieve pain. Our next step is to be a little bit more active or aggressive in treating that pain and at the same time working on strengthening. So I'm going to take the pillow out, I have Shannon lay flat on the table, and we're going to do what they call an alternating arm and leg exercise. So we're going to have Shannon take her right arm, lift it straight up, and then with the opposite leg, lift up from the thigh, causing an extension at the spine and working the musculature across the spine. Again, having her hold for a count of 5, and down, and now opposite side. So this arm down, up, and the opposite leg up. And how does that feel, okay?
Yep.
Many times just this position will help to relieve acute neurologic back pain by decreasing the pressure on the nerve as it passes through that vertebral foramina. And switch to the other side. Now if this is difficult the first time, we can break it down into smaller components, just using the arm and not the leg. So right arm up, and then switch, and then left arm up. And again, if you're finding difficulty doing alternate arm and leg at the same time, we can break it down to components and bring it down. And then just the right leg up with no arm. And now the opposite side. Again, holding for a count of 5 seconds. And I usually recommend repeating 15 times. Relax. As this becomes easy, our next step is doing both arms together. What we like to call the Superman exercise. Lifting both up, bringing the trunk up, and holding for a count of 5. Again, a little more difficult, sometimes unable to do this in the acute phases of back pain, but as you start feeling better, a good exercise. And down, and when you get really good, we can alternate, keep your elbows here, and now do both legs up. A little bit more difficult, but working on strengthening of the back and the core, the gluteal muscles, your hip abductors, and down. And then again, when we're really starting to feel better and want to get a little bit more aggressive with our strengthening, we try to do both together. Shoulders and getting that nice extended position of the back. Holding for a count of 5 and not forgetting to breathe. And down, good. You can sit back up again. Now after doing extension exercises, I really like to follow it up with the exercises we talked about in the last video. Maybe doing a couple of flexion exercises just to loosen up and and get the musculature stretched out again. Another good exercise that I like to do following my extension exercises is just adding some rotation. So I'll have Shannon lay on her back again for me. Bending both knees up and slowly just rocking to one side and stretching out the area, the gluteal muscles, stretching out the muscles which sit directly on top of the sciatic nerve. A little muscle about the size of your thumb called the piriformis. When that muscle goes into spasm, it can press directly on a sciatic nerve, causing radicular pain or radiating pain, paresthesias, numbness into the leg. So again, 5 seconds and turn to the other side. So this is the first step in trying to stretch out that piriformis muscle, as well as getting some general flexibility in the back. On our next video, I'll speak a little more in depth of ways we can address this piriformis muscles and the pain it can cause at the back.